Hello, we are going to talk about cholinergic agonists. Cholinergic drugs are also known as parasympathomimetic drugs. These are the drugs which act on the receptors that are activated by acetylcholine, which is a neurotransmitter of parasympathetic nervous system. They are classified as direct-acting cholinergic agonists and indirectly acting ones, which are also called as anticholinesterases. Therefore, they're divided into reversible and irreversible ones. Before we discuss the drugs, let us first talk about cholinergic neuronal transmission. As we can see, it is divided into 6 steps. In the first step, choline molecule is transported in the neuron by energy-dependent sodium transport system. Once in the neuron, choline reacts with acetylcoenzyme A and forms acetylcholine. This step is catalyzed by choline acetyl transferase. The second step, acetylcholine gets transported into the presynaptic vesicle where it is protected from degradation. In the third step, action potential causes voltage sensitive calcium channels to open that allows calcium to enter into the axon. This leads to fusion of the vesicle to the membrane and release acetylcholine from terminals. Now in the fourth step, acetylcholine binds with the receptor in the postsynaptic vesicles and produce a biological effect. Now in the fifth step, the acetylcholine is broken into choline and acetate by the enzyme acetylcholine esterase. Now this rapid degradation of choline and acetate is the mechanism of action which we will be discussing later on for anticholinesterases. This choline molecule will be recaptured by the uptake system and back into the neuron and recycling will occur. As we have seen the third step, that release of neurotransmitter, this is blocked by botulinum toxin, and this recycling of choline is inhibited by hemicholinium. We'll see the two types of cholinergic receptors, that is muscarinic and nicotinic receptors. So muscarinic receptors, as the name indicates, they are selectively stimulated by muscarine and blocked by atropine. They are located on the autonomic effector cells in various organs, and they are further classified as M1, M2, M3, M4 and M5. Besides being present on the neurons, M1 are located in gastric glands, M2 are found in the cardiac cells, while M3 are found in smooth muscles in eye, lungs, digestive glands as well as exocrine glands of sweat and saliva. M4 and M5 are present in the CNS. Whereas nicotinic receptors, as the name indicates, they are selectively stimulated by nicotine and blocked by tuberculin. There are two types of nicotinic receptors, NM and NN. NM, that indicates the neuromuscular junction. They are present at the skeletal muscle end plate and cause skeletal muscle contraction, whereas NN are located in the CNS, adrenal medulla and autonomic ganglia. Now if we see the effects of acetylcholine on the various organs, so let us first see the effect of acetylcholine on eye. On eye, the effect produced by acetylcholine is called as miosis. Miosis is decrease in the pupil size. So this is due to the contraction of the circular muscle of iris. Contraction of the ciliary muscle causes reduction in the intraocular tension and increase outflow. So reduction in the intraocular tension, which is particularly useful for the patients of glaucoma. Second, we can see various gland secretions from all the parasympathetically innervated glands is increased via M3, M2 receptors. So sweating, salivation, lacrimation, all these are increased. If you see the effect of acetylcholine on heart, there is decrease in the heart rate and decrease in the cardiac output. This is because of SA nodal depression. Now, another effect is decrease in the blood pressure. Acetylcholine causes vasodilation because of the effect on cholinergic receptors in blood vessels, and that leads to increase in the intracellular nitric oxide, which is a endothelial derived relaxing factor. If we see the effect on the respiratory system, there are two effects. One is bronchoconstriction, because bronchial muscles constrict. So we can see asthmatics are highly sensitive. Second effect is all the secretions are increased, as I mentioned. So increased tracheobronchial secretion. For the effect on GIT, there is increase intestinal motility and secretion. Acetylcholine, we can say, it stimulates peristalsis and gastric secretion is increased. For genitourinary tract, the effect seen is increase detrusal muscle tone, and that causes bladder contraction, and it is used for voiding, that is urine expulsion. So let us talk about the drugs. Direct acting cholinergic drugs are the agents which mimic the effect of acetylcholine by directly binding to cholinereceptors. So we have choline esters and alkaloids, which are naturally occurring alkaloids like muscarine, aricoline, pilocarpine. And in the choline esters, we have synthetic esters of choline like methacholine, carbachol, and bethanechol. If we talk about acetylcholine, we have just discussed the neurotransmitter of the parasympathetic nervous system, and we have seen the effects, but therapeutically it is of little use because of multiplicity of actions, and it has both muscarinic and nicotinic activity. And secondly, it is rapidly inactivated by acetylcholine esterase enzyme. It's available as ophthalmic solution, which is used to produce meiosis in eye surgery. Now, therapeutically useful one is bethanechol, which is structurally related to acetylcholine. It has strong muscarinic activity but no nicotinic actions. And as we have discussed the effect of acetylcholine, it stimulates the detrusal muscle of bladder, and that activity or that effect is useful for the clinical use of bethanechol as post-operative, postpartum, non-obstructive urinary retention, that is to promote urination. So the side effects will be, some of the side effects are belching, colic, involuntary urination, flushing, and sweating. The next one is carbachol. It has both muscarinic and nicotinic action, rarely used because of high potency and short duration and long duration of action. And we can say, with the exception that it is used in the eye to cause meiosis and to decrease the intraocular pressure. We have pilocarpine. Pilocarpine is mainly used in ophthalmology. It exhibits muscarinic activity, produces rapid meiosis and contraction of the ciliary muscle. So clinical use of pilocarpine is the drug of choice in emergency lowering of intraocular pressure in case of glaucoma. And other uses can be after refraction testing, after the use of mydriatics, and to decrease the adhesion between iris and the lens. The side effects, it could be painful stinging sensation in the eye and spasm of accommodation, and it can enter the brain and cause CNS disturbances. So it may stimulate profuse sweating and salivation. Now we will discuss anticholinesterases. So as we have discussed, acetylcholine is broken into choline and acetate, and this is by the enzyme acetylcholine esterase. So this step is inhibited by the drugs. So anticholinesterases are the agents which will inhibit the acetylcholine esterase. So protect acetylcholine by hydrolysis. Okay, so that will increase the concentration of acetylcholine, or acetylcholine concentration will be more in the synapse, and it will produce cholinergic effects in vivo. So we have two types of drugs, reversible and irreversible. I'll just enumerate this first: carbamates and acridin. In carbamates, we have physostigmine, neostigmine, pyrrolostigmine, edrophonium, rivastigmine, donepezil, and galantamine. In acridin, we have dacryns. In the irreversible ones, we have organophosphates, icothiopate, malathion, tabune, serine. And in carbamates, we have carbaryl and propoxyl. So, in case of irreversible ones, many of these agents, as we can see, they are extremely toxic and they were developed by military as nerve gases. For example, tabune and serine. And as we can see, malathion, parathion, carbaryl, propoxyl, these are used as insecticides. So from irreversible anticholinesterase, only therapeutically active drug is icothiopate. Now this icothiopate forms covalent bond with acetylcholinesterase, and this is used in open angle glaucoma only. While the uses of anticholinesterases we will discuss first as meiotic. In glaucoma, meiotics increase the tone of ciliary muscle and the sphincter pupillae so that intraocular tension falls in open angle glaucoma. So pilocarpine is a preferred choice. We have already discussed this drug. Physostigmine is used 0.1% to supplement pilocarpine and to reverse the effect of mydriatics after refraction testing to prevent the formation of a division between iris and the lens or iris and the cornea. The next use is myasthenia gravis. Myasthenia gravis is an autoimmune disease which is developed due to the development of antibodies directed towards nicotinic receptors. So that causes damage to the neuromuscular junction and there is weakness, muscle weakness and easy fatigability. So the drug of choice is neostigmine. Neostigmine improves muscle contraction by allowing acetylcholine to accumulate by directly depolarizing the end plate. There is one other drug which is mentioned here, it is edrophonium. It resembles neostigmine in action and this has brief duration of action, 10 to 30 minutes, and it is suitable only as a diagnostic agent for myasthenia gravis. And as we have discussed with methanicol, the next use is postoperative paralytic ileus or the urinary retention. This is relieved by 0.5 to 1 milligram subcutaneous neostigmine. Next use is postoperative decolorization, for which neostigmine 0.5 to 2 milligram IV given preceded by atropine to block the muscarinic effects. And lastly, Alzheimer's disease. Alzheimer's is neurodegenerative disorder which affects the cholinergic neurons in the brain. The drugs which are used are anticholinesterases, that is rivastigmine, donepezil and galantamine. And finally, the side effects of anticholinesterases: diarrhea, urination, meiosis, bradycardia, emesis, lacrimation, salivation and sweating. Thank you.